So at the proximal tube, we have sodium coming in, we have bicarbonate coming in. And because the sodium and bicarbonate cannot be fused to the cell, they will need a special pump or transport mechanism to help them go into the cell. So we have the sodium hydrogen exchange pump, which takes sodium, pump it into the cell in exchange for hydrogen. The sodium that comes into the cell is pumped out of the cell through the sodium potassium ATPase pump. So it takes sodium from the cell, pump it back into the blood. So always inside of the cell is poor in sodium, and it takes potassium from the blood and pump it back into the cell. So the cell is mostly rich in potassium. But as I was discussing, when sodium is exchanged for hydrogen, the hydrogen ions will combine with the bicarbonate to form what we call carbonic acid. And when you have the carbonic acid, then an enzyme we call the carbonic anhydrase enzyme will split this reaction into carbon dioxide and water. The water will remain in the nephron and we pass it out as urine. The carbon dioxide will be fused into the cell, and the cell they will meet cytosolic water. So when they meet water, then they will form what we call the carbonic acid. And when we have the carbonic acid, then the enzyme we call the carbonic anhydrase enzyme will this time split the reaction back into hydrogen and bicarbonate. The bicarbonate will be fused through a special mechanism and will now enter into the blood. The hydrogen ions or the proton will be pumped out again, meet bicarbonate, and the reaction will go on. So the bicarbonate which was over here has been reabsorbed back into the blood. The sodium which was also here has been pumped back into the blood. So I said the carbonic anhydrase inhibitor will prevent reabsorption of sodium and bicarbonate ion. When you take the drug, what is the drug going to do? The drug will stop this reaction from happening. So if carbonic anhydrase enzyme does not split this reaction into carbon dioxide and water, then that means that we are going to lose this bicarbonate along. And the same drug will also block this reaction. And the same drug will also have effect on the sodium and hydrogen exchange pump. So in this case, we are not going to have proton secreted to come and combine to form the carbonic acid. Are you okay? So what happens is that when we take the carbonic anhydrase inhibitors, we are going to prevent the reabsorption of sodium and bicarbonate. The drug inhibits the carbonic anhydrase enzyme both at the luminal side and at the cytosolic membrane or side. In addition, it also has effect on the sodium and hydrogen exchange pump. So if hydrogen is not secreted, then that means that we are not, if we affect this pump, sodium will not be taken in. And if sodium is not taken in, what happens? Then we are not going to exchange sodium for potassium. Are you okay? And this hydrogen ions too will not also be secreted out to form this carbonic acid that we spoke about. Alright. So now that you have understood the mechanism of action, now let's go ahead and look at the uses of this drug. Let's go ahead and look at the uses of this drug. What do we use this drug for? This drug, the main use of this drug is not for diuresis. That means that if we don't use this drug to cause loss of fluid, the mainstay or the main use of this drug is for the management of what we call glaucoma. The main use of this drug is for the management of glaucoma. Glaucoma is more or less like pressure on the eyes, and the increase in pressure is due to excess production of aqueous humor on the eye. And the production of aqueous humor is dependent on the carbonic anhydrase enzyme. The production of aqueous humor on the eye is dependent on the carbonic anhydrase enzyme. So if you are able to give a drug that could inhibit carbonic anhydrase enzyme, then the production of aqueous humor will go down, and the pressure on the eye of the person can be well managed. So the mainstay or the main use of this drug is not for the management of glaucoma, for the management of diuresis, but we use it for the management of glaucoma. Then we can also use this drug to also treat or prevent what we call mountain sickness. Mountain sickness. Mountain sickness. There are some people, when they go at high altitude, some of them start experiencing certain unwanted symptoms. Some vomit a lot, some do have headaches, some unwanted reaction. When you go at high altitude, because of less oxygen concentration at high altitude, what you do is that you hyperventilate, and in the process of hyperventilating, you excrete a lot of carbon dioxide. That causes what we call respiratory alkalosis. So we can give this medication to really manage respiratory alkalosis. All right. Then thirdly, since this drug that we give, you are going to lose bicarbonate. And I said bicarbonate is a base, and base help in maintaining our blood pH. So if you are losing the base or the bicarbonate, what do you think will happen to the blood pH? Your blood pH will reduce. The blood pH will become what? Acidic. Are you okay? So we can use this drug to also manage what we call metabolic alkalosis. Metabolic alkalosis. We can use this drug to also manage metabolic alkalosis. If the pH of a person is above the normal limit, then we can use this agent to manage what those alkalosis, because this agent will help you to lose what bicarbonate. And if you are losing bicarbonate, then your blood pH will start what reducing or dropping. So we can use this drug to also manage metabolic alkalosis. Then this drug is also used to manage epilepsy, but the mechanism isn't that clear. But we use this drug to also manage what epilepsy. So with the uses of this drug, we use this drug to manage glaucoma. We use this drug to manage mountain sickness, and you can use this drug to manage metabolic alkalosis. You can use this drug to manage what epilepsy, and we can use this drug to produce minor form of what diuresis. So it means that this drug can produce diuresis, but that's not the main use of this agent. All right. Now let's talk about the side effects of this agent. Let's talk about side effects of this agent. So one side effect of this agent, if this drug is going to help the body to excrete bicarbonate, then what do you think will happen to the blood pH? The blood pH will drop. So that means that one side effect of this drug will be what? Metabolic what? Acidosis. So this drug can lead to what we call metabolic what? Acidosis. And the use of the carbonic anhydrase inhibitors also lead to loss of what? Potassium. The use of carbonic anhydrase inhibitors also lead to what? Loss of what? Potassium. And this drug should also, and one side effect of this agent again is what we call paresthesias, like numbness of the feet. Some people feel like there's some pain, even piercing part of their body. So this drug can lead to what we call what? Paresthesias. And this drug can cause nephrolithiasis in patients with history of recurrent kidney stone formation. This drug can precipitate nephrolithiasis in patients with recurrent kidney stone formation. So that means that we are not supposed to give this drug even to patients with history of what? Kidney stone formation, because this drug can lead up to what? Build up of what? Maybe calcium within the nephron that can lead to what? Nephrolithiasis. So these are some of the precautionary measures to take note of if you are going to use this drug to manage your patient. The next drug I'll be talking about very soon will be the loop diuretics. All right, so that's the next drug I'll be talking about. Thank you.